Well, as you know, when people come to our office, the first thing they ask is, I want to know if my child has ADHD.
Yes.
They want a diagnosis. And I think that's the wrong question to ask. I think the question to ask is, why is my child having trouble paying attention?
Mm-hmm.
Because that gives us more of an idea of what the underlying struggle is. And the better we understand what's going on underneath, the easier it is for us to craft an appropriate treatment plan.
Yes. Yes. I mean, okay. Thank you for saying that out loud, because sometimes some parents come to us because either a teacher, a daycare provider says, oh, this child has ADHD. You need to go see a doctor, get on medication. Right. And I love that you want to first step back and ask the question, well, why? What's happening here? We can't just automatically assume. We don't want to jump to conclusions, right? So I guess with that in mind, because I think a lot of parents are a little bit intimidated when they wait a long time to see someone like you, right? And they're like, oh my gosh, I don't have a lot of time, but how can I prepare? And what does the doctor need to know? And how do I make sure I give them that information? So I guess if we can kind of speak to that a little bit.
Well, I'm going to speak to that, but let me first give one more piece of context.
Yes.
When we're talking about mental health diagnoses, it's very different than somatic or physical health diagnoses. When somebody's diagnosed with diabetes, we know that their pancreas is not creating enough insulin, so their glucose level is running wild, and that's what diabetes is. But when we talk about mental health things, we come about the diagnosis not from a mechanism up approach, but from, well, these symptoms tend to cluster together, and so we're going to call it this. But that would be kind of like saying somebody has a headache disorder. That's not helpful to know if they have a headache disorder, because they could have a headache because they have a brain tumor. They could have a headache because they get migraines. They could get a headache because they have strain in their neck. Understanding the underlying piece is so much more important than lumping them together and putting them into a diagnosis. So any of those mental health diagnoses that are a symptoms name, ADHD, oppositional defiant disorder, aren't very useful. It's understanding what goes on underneath that really is important.